I was at the point in my life where I couldn't do the things I wanted to do. I couldn't walk anymore. I couldn't ride a bike anymore. And I couldn't golf anymore. So I had a new knee put in. And it's the best thing I've ever done in my life.
I think focusing on one specific activity, such as joint replacement, and for the most part we're talking about joints of the hip and the knee, we're able to hone right down on the therapy, pain management, and everything to benefit that group of people the best.
I see my job as a way to make sure people are comfortable before their surgery, while they're in the hospital, and then touching base with them afterwards. Just how did it go? How are things going for you at home now?
There's a huge team approach with all of the staff on the floor. We, from physical therapists, occupational therapists, nursing, and doctors, we all work together very closely.
The orthopedic surgeon who I talked to, it was wonderful. He sat with me for a full hour, and it was as if I was the only person in the world. I felt like he heard me, and I was very happy that I would be working with him. So I said, okay, well, what do we do next?
For a patient to be scheduled for surgery, they see their surgeon, they talk with the surgeon's nurse, they get a lot of great information from that nurse.
And then I went to the hip replacement class. They actually let you know exactly what's going to happen and who you'll be working with and how long this will take, and the fact that you'll have to do some exercises. So they let you know exactly what you're going to be getting into.
Pretty much right away, we try to reassure them that everything's going to be all right, and they find out that they really are going to be okay, and they're going to be up and moving and recovering very fast.
Their surgery date is set. I'll give them a call about 2 weeks ahead of time, talk to them about here's what's going to happen while you're here, what you can expect.
We like to encourage them that even though things have been difficult, maybe even before surgery, that following surgery, we're going to get them back to doing the things that they haven't been able to do in a long time.
Yes, I got out of surgery. They took me to my bed, they put me in the bed, and then they said, well, in a couple hours, we'll let you get settled in here, but you'll be up on your feet before you go to bed tonight. And I was, and I couldn't believe it.
I guess after I had the surgery, I had such instant relief that, that pain that I had all the time was not there.
And I'll see them while they're here in the hospital, kind of be their cheerleader. If you're doing great in therapy, how's it going today?
So you walk down to our therapy room and you engage in therapy with other patients who've had the same surgery as you.
I think that the group therapy is kind of where it seals the deal, where everybody comes together.
Going through this process with other people that are going through the same thing brings out questions and concerns that other people bring up that you wouldn't necessarily think about till you get home, and at that point it becomes harder to get the answers. So there are a lot of advantages from the team approach.
And then hopefully talk with them about a week after their discharge, just to touch base on how did it go and how are you doing.
Once you go home, you need to do the exercises, and you need to do the things to make sure that, you heal right.
I was just glad I could share it with him and be with him for the time. And I also, after his surgery, I was also his transportation to physical therapy, which he didn't like my driving, but he had no choice.
My coach is my husband, Richard. And the coach acts as someone who will encourage you to do your exercises to make sure that you keep moving so that your progress is steady and is going well.
Right, when we got home, I was the iceman, so I had the cooler full of ice and that put ice on the hips. A good coach, you got to be patient. Yeah. So this isn't going to be over with in a few minutes, but it's faster than you think.
The approach that we've taken at Essentia is to try to bring together experts in all the fields. So, for example, all I do is hip and knee replacement. I have partners that only do hand surgery, only do foot and ankle surgery. And all of those things allow that person to do more of that case and see more of those patients than anyone else. And it's through that repetition that you gain a lot of experience.
Oh, it seems like our patients do better. They're up, they're dressed, it seems like they're having less pain, they're going home quicker, their recovery's faster. It's just, we have great outcomes.
Well, I can do all the things that I wanted to do. I mean, I just came back from vacation, that my wife and I walked 3-4 miles on the beach. I can ride a bike again. and it probably improved my golf game by 10 strokes. So life is good, you know.
I had 2 years where I couldn't stand up straight, and now I can. And I had 2 years where I walked with a limp, and I don't do that anymore. And there's something about being able to stand up straight that is so fantastic. It does something for your whole countenance. You feel like a different person. You get yourself back again, and I love it.